Welcome back, doctor. Doctor, most of us think that acid reflux or heartburn is related to the stomach and around the stomach, right? But how on earth does that impact the nose or the sinus?
Well, many of us think that the acid reflux is associated with your heartburn, but many a time it is a silent reflux which is causing more harm. So the silent reflux is nothing but the LPRD, which is the full short form for Laryngopharyngeal Reflux disorder. So the laryngopharyngeal reflux is nothing but the acid from the stomach coming all the way to your throat, irritating your throat, and also it can go to the back of the nose and cause the sinusitis issue.
Okay, so explain it to me like a 5-year-old, right? How does basically the highway of or highway exit of your stomach end up in the nose?
So when you have a reflux, the issue is your lower esophageal sphincter or the food pipe valve, which is preventing your the stomach contents coming up. Sometimes that might be lax because of issues with the diaphragm or anything of that sort. So that leads, there's no other valve between the lower esophagus till your mouth. So
Okay.
because there's no valve, it will just come up without any stop and it will come to the back of the nose as well.
And can it show up as any allergies? I mean, can you tell us more about the symptoms? Because sometimes we may not even look at this as a symptom, right?
So the first and foremost symptoms which most of my patients present with is the throat irritation. They'll feel something is stuck in the throat. They'll have a chronic cough without much of mucus. So sometimes there might be mucus which from day coming out, and that mucus is also kind of whitish in color and not the typical infection related issue. So the issue would be the acid irritating the throat or the voice box, which causes them to cough because of the irritation, and that's how many a time it presents. And people will also present with some amount of sneezings and also their mouth being dry in the morning times when they wake up. So all these things, or when they wake up in the morning, they feel like they need to clear their throat before they start talking. So all of these symptoms are because of the acid reflux.
So is it fair to say that sometimes they present as allergies or, something that is caused by pollen, dust or something, but it may just be a silent reflux which is happening?
Yes, exactly. So because they are not having the heartburn sensation, they correlate it to unknown factors like allergies, allergic cough, allergic bronchitis, allergic various things, where the actual part might not be in the lungs or in the nose or in the throat. It's way down into the stomach.
Okay. Uh, that makes me more curious. Can you tell me any real cases that you've come across? I'm sure lots of them, but any case where the patient kept insisting or you found it very difficult to handle that scenario because the symptoms are very, very, very much like allergies.
Yes, I do get patients who tell that how is this possible? They won't be able to correlate it because this is the stomach and they associate stomach with just eating and nothing else. I do get patients who are not okay with the explanation which I give, but 99.99% of the or 99.9999% of all the patients do understand what is the issue because it's a simple thing like the graphic which I would have shown, where the acid from the stomach will come all the way to the throat and irritate the throat and the back of the nose, leading to all the symptoms, including the ear itching and ear block sensation which happens. So all of that is because the root issue is the gut, and because the gut is not properly taken care of, that leads to acid reflux. And they can also have something called as the hiatus hernia. This is where the stomach is sliding up into the chest, and that can also lead to reflux. So it can be so silent that they might not even know that there's an issue.
Okay. Is it fair to say that there are a lot of chances of misdiagnosis in such a scenario?
Yes, many a time, as I mentioned, Patients go to pulmonologists, the patients go to physicians, the patient goes to go to even cardiologists, thinking that they have heart palpitations and all those things. But the root cause is the stomach, which everyone is missing out.
Okay. So then, doc, hit us with some hacks that can be done. How do we take care of it? And
So the first and foremost thing to reduce the acid reflux is lifestyle changes. What is the first lifestyle change which you need to do is have food 2 hours before sleeping, water 30 minutes before sleeping. Why is this important? Because your stomach will be empty or half empty or partially empty when you go to sleep. So the distension of the stomach is not there. So that's why I tell all my patients to have food 2 hours before sleeping. So if you sleep by around 9 o'clock or 10 o'clock, have food by around 7 o'clock or 8 o'clock, because that your stomach is partially empty by the time you go back to sleep and the acid reflux doesn't happen. Number two, the actual way to sleep is not flat but in an inclined position. So how do you sleep in an inclined position? By putting newspapers underneath the mattress, inclining the whole mattress, and ensuring that the stomach contents go down and via gravity and doesn't come up against gravity. If you sleep flat, the stomach and your throat will be in the same level and the contents will come up to your throat. That's the second hack. Third hack is to ensure that if you have acidity issues, ensure that you don't have anything which is very spicy. Don't have aerated drinks which will cause dilation of your stomach and again cause some amount of acid reflux. Ensure that you have coffee or tea. If you're an addict to coffee and tea, you can go around saying that I can't stay away from coffee or tea. Have the coffee and tea in the morning time before your lunch. After your lunch, keep away from coffee and tea. And also the oily foods, stay away from oily foods, that will reduce the acid reflux. So these are the few things which are the hacks to prevent the acid reflux.
okay, but doctor, if we cut down on a lot of these, right, it gets very, very difficult for some of us. So, just to be real, what are three food, you could say cuisines or different types of food items that you would say is a complete no-no for somebody suffering from this?
So a complete no no beyond the diet is, the first thing is no smoking. You have to stop smoking because the smoking is the number one culprit if you're a smoker for your acidity. Number two is your oily food, which is deep fried food. So if at all you want to have the deep fried food, have it in the first half of the day, not in the second half of the day. Third is extreme spice, the chili spice. You need to avoid these three. If you avoid, you'll be fine.
Okay, but when we say that, is it fair to say that when the silent reflux happens, right, patients find it very difficult to judge whether it's a nose issue, ear issue. They might end up going to an ENT surgeon, but how do they self-diagnose? Is there some way a patient can try to understand?
So a patient might have symptoms of burping. That's one of the features of silent reflux. They might have features of throat irritation. You definitely will feel some kind of irritation in your throat. Then you'll start coughing. That's another noticeable, significant chance of your acid reflux. The most clincher is in the morning when you wake up. You need to clear your throat before you start talking. That is the clincher for your acid reflux or silent acid reflux.
Okay. I've got some interesting questions. Okay, to start off, have you diagnosed somebody with acid reflux who's refused to give up on coffee or spicy food?
Yes, I do. For them, and that's why I would put them on medications, because with just the lifestyle change, whatever I advise, they would have not had this kind of symptoms. I do put them on medications for about initial period of till the lifestyle change kicks in. But if people insist on not changing their lifestyle, then they'll continue to have the medications which I would prescribe them.
Okay, and one uh, debate topic. Okay, so let's settle this. Would you say late night pizzas are bad or late night biryanis are worse?
Well, it depends on what kind of biryani it is. So if it's extremely spicy Hyderabadi biryani, then that's definitely the main accused person. But again, in pizza, if it's a extremely spicy pizza, then again, pizza is the worst thing. But if you look at it from the nutrition point of view, pizza is definitely worse, depending on if it's not a sourdough pizza.
Okay. So, and I think it goes without saying, late night anything is bad.
Yes, late night anything is bad, especially if you're having a Coke along with your pizza or any aerated drink along with your pizza. That's the worst which you can do.
And what are your thoughts on the lifestyle changes that are there currently? You know, a lot of people have late nights, meetings, a lot of stress. So, does that also impact this?
Yes, stress definitely increases the chances of your acid reflux because the more you stress, you tend to breathe, hyperventilate, and when you hyperventilate, your diaphragm will get pushed more and more, and that leads to your diaphragm not functioning properly, leading to the lower esophageal valve not functioning. So, stress definitely would lead to increased acid reflux, and also late night eating, snacking, because you're working late nights at office. I would advise you to carry a lunchbox, or since you have Swiggy, orders from Swiggy and have something at regular times to ensure that you don't have excessive extremely late nights of food.
So, now on to some quick rapid fire round, right? So,
Okay.
what is the weirdest reflux trigger you've seen in a patient?
So the reflux triggering the running nose of a patient. So I had a patient who was telling that, doc, everything is good except that suddenly in the middle of the night I have a running nose. I'm like, okay, that's totally odd. Why is that? Then when I was examining him and probing him to understand, then he was like he had a bad habit of having late night food, and that was the cause. So he modified that, and he's absolutely fine.
Wow, that's something I wouldn't have imagined as well. So, if stomach acids could talk to your sinuses, what would it say?
So it would say, "Hi, hey, watch out! I'll trigger you."
Nice. And best late night snack that you would advise?
Late night snack, I would advise water 30 minutes before food, before sleeping.
Let's be real, doctor. Some snack, I mean, water may not quench sometimes.
Well, then buttermilk, the max. Not nothing which is aerated, nothing which is
Solid as well.
not solid, because when you are sleeping, when you're trying to go on to sleep, that will cause more amount of an acid reflux.
Nice. And what's one health myth you wish people would stop Googling?
One health myth which people would stop Googling. I don't know what is that, because anything and everything which they Google is a myth according to me, which Google throws out. So stop Googling.
Okay, I think that's the right thing to do. If you have any health issues, avoid Googling, visit your family doctor, then take it from there.
Yes, that's the better way forward.
Excellent. So there you have it. Thank you so much, doctor.